How do you assess a patient's readiness for discharge?
Assessing a patient's readiness for discharge is a multifaceted process that involves a thorough and holistic evaluation to ensure they can return to their home environment safely and with the necessary support. My approach is systematic and begins as soon as the patient is admitted, not just on the day of discharge. I start by collaborating with the patient and their family to understand their home situation, their support network, and any potential challenges they may face. A key part of my assessment is to evaluate the patient's clinical stability. I ensure their vital signs are within normal range, their pain is well managed, and they are no longer in need of acute medical intervention. For example, if a patient has been on intravenous antibiotics, I would confirm that they have been switched to oral medication and can tolerate it without any issues. I also assess their physical and cognitive ability to manage at home. I would observe if they are able to perform activities of daily living, such as walking to the bathroom or preparing a simple meal, and if they understand their medication regimen and follow-up appointments. This is where I would consult with an occupational therapist or physiotherapist to get their professional input. Another crucial component is ensuring all necessary documentation and arrangements are in place. I would confirm the prescriptions are ready, follow-up appointments are scheduled, and that any required community support services, such as home care or district nursing, have been arranged. I would then provide comprehensive discharge education to the patient and their family, covering topics like wound care, medication management, and red flag symptoms to watch out for. I would not consider a patient ready for discharge until I am confident they, or their designated caregiver, fully understand the instructions and have all the resources they need to continue their recovery safely.
What steps do you take to ensure continuity of care post-discharge?
Ensuring continuity of care post-discharge is a critical aspect of my role, as it directly impacts a patient's recovery and well-being. My approach is a systematic process that begins long before the day of discharge. I start by collaborating with a patient, their family, and the entire multidisciplinary team, including doctors, social workers, and pharmacists, to create a comprehensive discharge plan. The goal is to make sure the transition from the hospital to their home or another care setting is as smooth as possible. A key step I take is providing thorough patient education. I don't just hand a leaflet to the patient. I take the time to sit with them and their family to explain their medication regimen in a way that is easy to understand. I'll review each medication, including its purpose, dosage, and a clear schedule, and I'll use tools like a medication chart to help them. I also ensure they fully understand any ongoing care needs, such as wound care instructions, dietary restrictions, or signs of a potential complication to watch out for. I make sure to ask them to teach back the instructions to me to confirm their understanding. To further ensure continuity, I make sure all necessary follow-up appointments are scheduled before they leave the hospital, and I provide them with contact information for their community nurse or GP. For patients with complex needs, I will personally contact the community health services to give a detailed verbal handover. This proactive communication ensures that the care team in the community is fully briefed on the patient's condition, the care they received, and the plan for their ongoing care. By doing so, I can feel confident that my patients are set up for a successful and safe recovery.
How do you handle a situation where a patient refuses discharge?
Refusing discharge can be a difficult situation for a nurse, but it's essential to handle it with empathy and respect for the patient's autonomy. My first step would be to sit down with a patient in a private and quiet area to listen to their concerns. I would use open-ended questions to understand why they are hesitant to leave. It could be due to anxiety about managing their health at home, fear being alone, or concerns about a lack of support. My priority is to validate their feelings and build a sense of trust, ensuring they feel heard and not pressured. Once I understand their concerns, I would take a collaborative approach. I would address their specific worries with clear, reassuring information. For example, if the patient is worried about medication management, I would offer to involve the hospital pharmacist to provide a detailed education session. If their concern is a lack of social support, I would immediately contact the social worker to explore what community services are available, such as home care or Meals on Wheels. I would explain that the healthcare team is not just focused on their time in the hospital, but also on their safety and well-being after they leave. If after this discussion and offering solutions, the patient still refuses to be discharged, I would escalate the matter to my senior nurse or the unit manager. I would provide a comprehensive handover of the patient's concerns and the steps I've taken to address them. The manager would then consult with the medical team and other members of the multidisciplinary team to find a solution that respects the patient's wishes while ensuring their ongoing safety. It is crucial to document every step of this process in the patient's file to ensure a clear record of the events and the professional response.
Describe a time you identified a gap in a discharge plan. What did you do?
Identifying a gap in a discharge plan is a crucial part of a nurse's professional responsibility to ensure a patient's safety. A clear example of this occurred with a patient named Mrs. Thompson, an elderly lady who was being discharged home after a bout of pneumonia. The initial discharge plan was straightforward. She was medically stable, and her prescriptions were ready. However, during my final assessment, I noticed she seemed anxious and kept asking about her daughter, who was supposed to pick her up. She also had some difficulty recalling her new medication schedule, despite having a written plan. Recognizing these subtle cues, I initiated a conversation with her to better understand her concerns. She revealed that her daughter was traveling for work and wouldn't be back for a few days, and she felt overwhelmed by the thought of managing her medications alone. This was a significant gap. The plan assumed a consistent caregiver was in place, which wasn't the case. If I hadn't identified this, she would have been discharged with a high risk of readmission due to missed medications or a fall. My immediate action was to inform the charge nurse and the social worker about the situation. I also contacted her daughter with the patient's permission to confirm the new situation. Working collaboratively, we revised the discharge plan to address these new findings. The social worker arranged for a community nurse to visit Mrs. Thompson daily for the first week to administer her medications and provide support. The team also coordinated with a volunteer service to deliver meals. I took the time to review the medication plan with Mrs. Thompson one more time, using a simple pill box to help her organize her medications. By proactively identifying and addressing this care gap, we ensured Mrs. Thompson was discharged safely with the necessary support, preventing a potential readmission and ensuring her successful recovery at home.
How do you coordinate with multidisciplinary teams during discharge planning?
When coordinating with multidisciplinary teams during discharge planning, my primary focus is on ensuring a seamless and safe transition for the patient. I see myself as the central communication hub, responsible for connecting all the different professionals involved. My first step is always to initiate a team meeting or a group huddle, where we can discuss the patient's individual needs and create a shared, cohesive plan. For instance, with an elderly patient recovering from a fall, I would ensure that the physiotherapist provides an update on the patient's mobility, the occupational therapist reports on their ability to manage daily tasks at home, and the social worker discusses the availability of family or community support. I take a proactive approach to this coordination. Rather than waiting for others to come to me, I reach out to each team member to gather their specific recommendations. I would speak with the doctor about the medical discharge summary and follow-up care, consult with a pharmacist about the medication regimen and potential side effects, and connect with the community care team to arrange for home visits or nursing support. This comprehensive approach prevents gaps in care and ensures that all aspects of the patient's well-being are considered. I would then consolidate all of this information into a clear, understandable discharge plan that is reviewed and approved by everyone. Before the patient leaves, I make sure the patient and their family are fully educated on the plan and have all the necessary contact information. This collaborative effort not only enhances patient safety, but also empowers the patient to continue their recovery successfully at home.
How do you communicate discharge instructions to patients with low health literacy?
To communicate discharge instructions to patients with low health literacy, I adopt a patient-centered approach that prioritizes clarity, simplicity, and compassion. My process starts by creating a safe and non-judgmental environment where the patient feels comfortable asking questions. I would never assume a patient understands complex medical jargon. Instead, I use plain, everyday language to explain their condition, medication, and follow-up care. For instance, rather than saying, "Take this medication," I would say, "Please take this tablet twice a day, once in the morning and once in the evening." A crucial part of my strategy is to use visual aids and teach-back methods. I would use simple diagrams, pictures of pills, or a clear medication schedule to help them visualize the instructions. For example, if a patient needs to manage a wound, I would demonstrate the dressing change process step by step and then ask them to show me how they would do it. This teach-back method allows me to assess their understanding and correct any misunderstandings on the spot. I would also involve a family member or caregiver in the discussion with a patient's permission so they can reinforce the instructions at home. Lastly, I ensure the patient has a clear written summary of the instructions that is easy to read and understand. This document would include contact numbers for the hospital and their community health team. I always end the conversation by asking if they have any remaining questions and reassure them that they can call at any time if they forget something. My goal is to empower patients with the knowledge they need to manage their health confidently and safely after leaving the hospital.
How do you involve family members in the discharge process?
Involving family members in the discharge process is absolutely essential to a patient's successful recovery and to ensuring continuity of care. My approach is to see the family as a key part of the care team, not just visitors. The process of involving them starts well before the day of discharge. I begin by speaking with them to understand their capacity to assist with care at home, their living situation, and any concerns they might have. This helps me tailor the discharge plan to their specific circumstances. During the planning phase, I make sure the family is present for all relevant discussions with a multidisciplinary team, including the doctor, social worker, and physical or occupational therapists. This ensures they have a full and accurate understanding of the patient's condition and the support they will need. When it comes to discharge education, I use clear, simple language and involve them directly. For instance, I would demonstrate how to change a dressing or manage a feeding tube, and then have the family member perform a teach-back to confirm their understanding. I also make sure they know what specific signs and symptoms to look for that would indicate a problem, such as fever or increased pain, and who they should contact in an emergency. Finally, I provide them with a comprehensive discharge summary that includes medication schedules, follow-up appointments, and contact information for community resources. I emphasize to them that they are a vital link in the patient's care and encourage them to call with any questions, no matter how small they may seem. By treating the family as a partner throughout this process, I empower them to provide safe and effective care, which significantly reduces the risk of readmission and promotes a smooth recovery for the patient.
Describe a time when poor communication affected a patient's discharge. How did you resolve it?
During my career, I've seen firsthand how poor communication can impact a patient's care, particularly during discharge. A notable situation involved an elderly resident who was medically stable and ready for discharge to her daughter's home. The initial discharge plan was in place, but during a final assessment, I noticed the resident's daughter seemed very stressed and unsure about the medication schedule. It became clear that there was a breakdown in communication between the team and the family. The doctor had given a verbal list of medications, but it hadn't been written down or explained in a way the daughter could easily understand. This was a significant patient safety issue that could have led to a medication error or a readmission. My immediate step was to take a proactive approach to fix the problem. I calmly took the daughter to a quiet room and listened to her concerns without any interruptions. I learned that she was a visual learner and felt overwhelmed by the verbal instructions. To resolve this, I didn't just re-explain the medication. I sat down with her and created a simple, color-coded medication chart. I wrote down the name of each medication, its purpose, the exact time it needed to be taken, and the correct dose. I also drew a picture of each pill next to the instructions to make it even easier to follow. I then performed a teach-back exercise, asking the daughter to explain the schedule to me, which confirmed she now understood it perfectly. I also made sure she had my contact information for any follow-up questions. By taking the time to address this communication gap directly and tailoring the information to her needs, we ensured a safe and smooth discharge for the resident, preventing a potential adverse event.
How do you ensure external agencies, e.g. home care, rehab, are aligned with the discharge plan?
To ensure external agencies are aligned with a patient's discharge plan, I initiate clear and proactive communication well in advance of the patient's discharge date. My approach is to serve as the primary link between the hospital's multidisciplinary team and the community-based care providers. This coordination is crucial for a safe and seamless transition of care, preventing a patient from falling through the cracks once they leave the hospital setting. First, I ensure that the patient's consent for information sharing is obtained. Once that is in place, I provide a comprehensive, detailed verbal and written handover to the external agency. This includes not only the standard medical information, but also nuanced details about the patient's individual needs and preferences that may not be in the medical chart. I would communicate the full medical history, the reason for the hospital stay, the patient's current status, and a clear outline of the ongoing care plan. This would include specific instructions for medication administration, wound care protocols, mobility goals, and any potential signs of deterioration to watch for. I would also highlight any psychological or social needs that were identified during the patient's stay. I make sure to provide the external agency with direct contact information for the relevant members of the hospital team, allowing them to ask follow-up questions if needed. This open line of communication builds a collaborative relationship and ensures that the care team in the community is fully prepared to take over. I consider the external agency to be an extension of our team, and I see it as my responsibility to empower them with all the necessary information to continue providing a high standard of care. By meticulously coordinating and communicating, I can feel confident that the patient's care will remain consistent and safe after they are discharged.
What strategies do you use to build rapport with patients during discharge planning?
Building rapport with patients during discharge planning is fundamental to my practice, as it directly impacts their willingness to follow instructions and their overall safety after leaving the hospital. My primary strategy is to approach every patient with genuine empathy and respect. I start by getting to know them as a person, not just a patient. I'll ask about their interests, family, and home life to build a connection that goes beyond their medical condition. This helps create a comfortable and trusting environment where they feel safe to voice their concerns and fears about leaving. Another key strategy is to involve them as an active partner in the planning process, rather than a passive recipient of instructions. I use collaborative language, asking questions like, "What are your biggest worries about going home?" Or "How can we make this plan work for you?" This empowers them and makes them feel like they have control over their own care. I avoid using medical jargon and instead use simple, everyday language. For instance, I would not just say, "Take your medication as prescribed." Instead, I would use plain language and clear visual aids like a medication chart to help them understand. I would show them the tablets, explain what each one is for, and use a teach-back method to confirm their understanding. Lastly, I ensure that all my communication is open and honest. I never make promises I cannot keep, and I always manage their expectations about their recovery timeline. For example, if a patient is worried about being able to walk up a flight of stairs at home, I would be honest about their current limitations while providing a clear plan for how physical therapy can help them achieve that goal. By building a rapport based on trust, respect, and clear communication, I can ensure that the patient feels empowered and confident in managing their health after discharge.
How do you manage discharges when social or financial barriers exist?
Managing patient discharges when social or financial barriers exist is a significant challenge, but it is a core part of my responsibility as a patient advocate. My first and most critical step is to identify these barriers as early as possible in the patient hospital stay. I do this by building rapport and conducting a thorough social history assessment, asking questions about their living situation, family support, and financial resources. I would not assume anything about a patient's circumstances. Once I have a clear understanding of the barriers, for example, a patient living alone with no family support or an inability to afford necessary medications, my role is to connect them with the appropriate resources. I would immediately contact the social worker and the case manager to create a collaborative discharge plan. I would advocate for the patient to ensure their needs are prioritized. For instance, if a patient cannot afford their medication, the social worker can help them apply for financial assistance or connect them with a program that provides discounted prescriptions. Similarly, if they are living alone and cannot manage their care at home, we would explore options for home care services or a short-term placement in a rehabilitation facility. I would also use my clinical knowledge to find practical solutions. For example, if a patient needs complex wound care that a family member cannot perform, I would work with the community nurse to ensure a home visit is arranged. Throughout this entire process, I would keep the patient and their family informed and involved. My role is to not only facilitate the discharge, but also to ensure the patient has a safe and successful recovery without the added stress of social or financial concerns. By taking a proactive, collaborative, and empathetic approach, I can help to overcome these barriers and ensure the patient's well-being is safeguarded.
Describe a challenging discharge case and how you handled it.
A particularly challenging discharge case I handled involved an elderly gentleman named Mr. Chin, who was recovering from a minor procedure. While medically stable, his discharge was complicated by a significant language barrier. He spoke very little English, and he lived alone with no immediate family to assist with his care. My primary concern was his ability to safely manage his complex medication regimen and wound care instructions after leaving the hospital, which he expressed a lot of anxiety about through a translation app. My approach was to manage this holistically and collaboratively. My first step was to immediately involve a hospital-certified interpreter to facilitate clear communication between Mr. Chin, myself, and the rest of the team. During our discussions, I focused on building trust and validating his fears. I then coordinated a meeting with a social worker to discuss arranging community-based support. We successfully arranged for a home care nurse to visit him daily for the first 2 weeks to assist with his wound dressing and to ensure he was taking his medications correctly. To address his concerns about the medication schedule, I worked with a pharmacy to create a personalized visual medication chart. This chart used pictures of each pill and showed exactly what he needed to take them, which bypassed the language barrier. I also used the teach-back method, having him show me how he would use the chart to ensure he fully understood. I also provided him with a simple contact sheet with pictures of the key people and their names he could call for help. By taking a proactive, multidisciplinary, and empathetic approach, we successfully resolved the challenges, and Mr. Chen was discharged safely and with much greater confidence, knowing he had a support system in place.
What would you do if a patient's home environment is unsafe for discharge?
If I determine that a patient home environment is unsafe for discharge, my immediate priority is to advocate for their safety and prevent a premature or risky return home. My first step is not to panic or simply refuse the discharge, but to gather factual information and initiate a formal process to address the issue. I would conduct a thorough and objective assessment of the patient home situation, documenting specific concerns such as a lack of running water, an inability to climb stairs, or the absence of a working caregiver support system. This detailed assessment is crucial for providing evidence to the rest of the multidisciplinary team. Once I have the necessary information, I would immediately raise my concerns with the charge nurse and the entire multidisciplinary team, including the social worker, occupational therapist, and the doctor. I would present the evidence from my assessment and explain the potential risks to the patient if they are discharged to an unsafe environment. The social worker is a key partner here, as they have the expertise and resources to explore alternative options. For example, they might arrange for a home assessment by a community-based team, secure a temporary stay in a rehabilitation facility, or connect the family with resources to make the home safer. Throughout this process, I would ensure that the patient and their family are kept informed and are involved in the decision-making process. It is important to handle these conversations with empathy, acknowledging their wishes to go home while explaining my professional obligation to ensure their safety. I would work collaboratively with the team to find a safe and sustainable solution, even if it means delaying the discharge. My ultimate goal is to ensure the patient leaves the hospital with a robust plan that supports their health and well-being, rather than putting them at risk.
How do you prioritize multiple discharges on a busy shift?
Prioritizing multiple discharges on a busy shift requires a calm and strategic approach to ensure both patient safety and efficient workflow. My first step is to perform a quick but comprehensive assessment of each patient's discharge needs. I'll identify which patients are medically stable and have all their discharge documentation and prescriptions ready. These straightforward discharges will be my initial priority to get them processed smoothly. I would also consider the social aspect. A patient with family waiting, for instance, might be prioritized to free up a bed sooner. However, the more complex cases, such as those with new medications, new diagnoses, or intricate wound care instructions, require more of my time. I would cluster their care, setting aside a specific time block to meet with a patient and their family to provide thorough education. For these patients, I would also coordinate with a multidisciplinary team, such as the social worker or pharmacist, to ensure all their needs are met before they leave the hospital. I would also delegate some tasks to other competent staff members, such as a care assistant, to help with packing a patient's belongings or ensuring they are ready for transport, freeing me up to handle the more clinical aspects of the discharge. Throughout the shift, I would use a prioritization tool to help me manage the workload. I would mentally rank each discharge based on urgency, complexity, and resource needs. I also believe in communicating openly with my team, letting them know my plan and asking for support when needed. By taking a systematic and collaborative approach, I can ensure that every patient receives a safe, well-planned discharge, even when the shift is particularly busy.
What's your approach when discharge plans change suddenly?
When a discharge plan suddenly changes, my immediate approach is to remain calm and focused on patient safety. I understand that sudden changes, while disruptive, are often necessary due to a new clinical issue, a change in a patient home situation, or a lack of available community resources. My first step is to get the full picture by communicating directly with a doctor or senior nurse who made the change. I would ask for a clear explanation of the reason for the alteration and any new care instructions. This ensures I'm fully informed and can provide accurate information to the patient and their family. My next action is to quickly update the entire multidisciplinary team. I'd reach out to the social worker to see if a new social assessment is needed or if alternative home care arrangements must be made. I'd also check in with a pharmacist to adjust the prescription and with a physiotherapist or occupational therapist to modify any home exercise or equipment plans. It's a team effort, and every professional needs to be aligned on the new plan to prevent errors. Finally, I would communicate the change to the patient and their family. I'd approach this conversation with empathy, acknowledging that the change might be disappointing or frustrating. I would explain the clinical reasons for the change in simple terms, focusing on how the new plan is in their best interest for a safe and successful recovery. I would answer all their questions patiently and reassure them that we're all working to ensure they get the best possible care, even if it means a slight delay. My goal is to be a reliable source of information and support during a stressful time, ensuring the new plan is just as comprehensive and safe as the original.
What key elements must be included in discharge documentation?
Discharge documentation is a fundamental aspect of nursing care, serving as a critical communication tool that ensures patient safety and a seamless transition from hospital to home or another care setting. A comprehensive discharge summary is a complete record that provides a clear and accurate picture of the patient hospital stay and their care plan moving forward. The first key elements I must include are the patient's demographics and details of their stay, such as their full name, date of birth, and dates of admission and discharge. Following this, I provide a concise summary of their reason for admission and their hospital course. This includes the primary diagnosis, any significant procedures performed, and a brief overview of their response to treatment. This context is vital for any subsequent healthcare provider who may care for them. Next, and perhaps most importantly, is the medication reconciliation. I must provide a precise list of all medications to be taken at home, including the name, dosage, route, and frequency. I also make a note of any medications that have been discontinued or changed during their stay. This step is crucial in preventing medication errors. I then document the patient's condition on discharge, providing a clear baseline of their physical and mental state. Finally, the documentation must contain a comprehensive ongoing care plan. This includes details on all follow-up appointments, clear instructions for wound care or managing any medical devices, dietary guidelines, and an explicit list of red flag symptoms that should prompt the patient to seek medical attention immediately. I also ensure all contact information for their community health team is included. Meticulous and clear documentation is a professional responsibility that directly contributes to the patient's successful recovery.
How do you ensure compliance with hospital policies and legal requirements during discharge?
Ensuring compliance with hospital policies and legal requirements during discharge is a non-negotiable aspect of my professional practice. It is a critical component of patient safety and professional accountability. My approach is systematic, beginning with proactive planning and meticulous documentation to ensure every step aligns with established protocols. I view hospital policies and legal frameworks, such as those set by the Nursing and Midwifery Board of Ireland and MBI, not as a checklist but as the foundation for safe ethical care. My process starts well before the patient is ready to leave. I use the patient's electronic health record to verify that all necessary orders, from medication prescriptions to follow-up appointments, are completed and signed off by the appropriate healthcare professionals. A key part of this is medication reconciliation, where I meticulously compare the medications the patient was on at admission with their new discharge list. I ensure that the documentation is clear, accurate, and reflects a seamless transition of care. Every detail, no matter how small, is a potential legal risk if not documented correctly. To ensure patient and family compliance, I go beyond simply handing over a form. I use the teach-back method, a legally sound strategy to confirm that the patient truly understands the instructions. For example, after explaining the schedule for their new medication, I would say, "Just so I know I've been clear, can you tell me in your own words how and when you'll be taking this medication?" If they are unable to articulate it, I have a professional obligation to re-educate them until they can. All of these steps, from the verification of orders to the final patient education, are thoroughly documented in the patient's chart. This comprehensive process not only protects the patient but also ensures that all care provided is defensible and aligns with the highest legal and professional standards.
How do you handle confidential information during discharge coordination?
Handling confidential information during discharge coordination is a fundamental ethical and legal responsibility for a nurse. My approach is governed by the principle of need to know, ensuring that patient information is shared only with those directly involved in their care and only to the extent necessary. My first step in this process is always to obtain explicit consent from the patient to share their medical information with the relevant external agencies, such as home care providers or a community-based rehabilitation team. This consent is crucial and is documented thoroughly in their health record. When I am communicating with external agencies, I use secure and approved channels for transmitting information, such as encrypted digital systems or professional secure lines. When giving a verbal handover, I ensure I am in a private space, away from other patients, visitors, or staff members who do not require this information. During the handover, I provide a concise and factual summary of the patient's condition and their ongoing care needs, such as a new medication regimen or specific wound care instructions. I deliberately exclude any sensitive personal information that does not directly impact their care, such as family disputes or financial details. For example, I would share the details of their new medication and the schedule for its administration, but I would not share information about their personal finances or their family's living situation unless it has a direct bearing on their safety after discharge. This selective approach is vital to respecting the patient's privacy and building trust. My commitment is to ensure the patient's care is seamless and safe without compromising the strict confidentiality that is the cornerstone of the nurse-patient relationship.
What motivates you in the role of a discharge coordinator?
What motivates me most in the role of a discharge coordinator is the direct and meaningful impact I can have on a patient's long-term health and well-being. While a nurse's primary role is to provide excellent care within the hospital, the discharge coordinator is uniquely positioned to ensure all that good work translates into a safe and successful recovery at home. I find immense professional satisfaction in being the final link in the chain of care, knowing that a comprehensive and well-executed discharge plan can prevent readmissions and improve a patient's overall quality of life. I am particularly motivated by the challenge of solving complex problems and acting as a strong patient advocate. In many cases, a patient's safe discharge is not just a clinical matter, but also involves navigating social and financial barriers. I am driven by the opportunity to collaborate with multidisciplinary teams, social workers, pharmacists, and community health providers to find creative solutions for a patient's unique needs. For example, ensuring a patient who lives alone has a support system in place, or that another can afford their necessary medications, is incredibly rewarding. This role also aligns with my passion for holistic, patient-centered care. It allows me to see the full picture, from the moment a patient is admitted to the moment they are safely settled back in their community. The feeling of helping a patient feel confident and empowered as they leave the hospital, knowing they have a clear plan and support network, is what truly energizes me in this role. It is a position where I can apply my clinical expertise while also making a tangible, positive difference in people's lives.
How do you stay updated on best practices and discharge protocols?
In nursing, staying updated on best practices and discharge protocols is not just a professional obligation. It is a critical component of providing safe and effective care. My approach to continuous learning is multifaceted, combining formal education, informal learning, and active participation in the professional community. First and foremost, I am proactive in seeking out continuing professional development, CPD opportunities. I regularly attend webinars, workshops, and courses offered by professional bodies such as the Nursing and Midwifery Board of Ireland, NMBI, and the Health Service Executive, HSE. These platforms are invaluable for learning about new evidence-based guidelines, advancements in patient care, and changes to national discharge protocols. For instance, I recently completed an online course on complex wound care, which directly informed how I educate patients on dressing changes and signs of infection at the time of discharge. Secondly, I am a firm believer in the power of peer-to-peer learning. I make it a priority to attend and actively participate in clinical meetings and team huddles. These forums provide an excellent opportunity to discuss challenging discharge cases, share successful strategies, and learn from the experiences of my colleagues. By engaging in these conversations, I gain practical insights that I can immediately apply in my daily practice. Lastly, I maintain a habit of independent learning. I regularly read professional journals and credible healthcare publications to stay informed about the latest research and best practices. I also use these resources to stay current on new medication protocols and technologies that may impact a patient's discharge plan. This commitment to continuous learning ensures that my knowledge is always current and that I am providing the most effective, safe, and up-to-date care to every patient I serve.